All right, what I'd like to discuss with everyone is how tension headaches can be related to upper cervical spine injury. So what is an upper cervical spine injury? That doesn't mean you had to have your neck broken. Simple things such as whiplash accidents, being dropped on your head wrestling, diving off the diving board, hitting your head on the bottom of the pool. These types of injuries can cause the C1 or C2 vertebra, which is right at the base of the skull, to shift out of their normal position, tear the ligament and soft tissue, and dislodge the vertebra so it becomes locked under the skull. Now, there was some interesting research that came out. Actually, it's a new anatomical finding in the mid-90s. A few anatomists, and this is amazing because there's been thousands upon thousands of cadavers that have been dissected, and you would think after 100 years there'd be no new discoveries. But the new discovery they termed the Myo-dural Bridge. And basically what that means is you have the spinal cord, and the spinal cord has a sock-like sheath that covers it. And then you have the muscles right at the base of the skull, and there's a connective tissue between the muscles and that sheath that covers the spinal cord. So myo being muscle, dural meaning the dura mater, the sock-like covering over the spinal cord, bridge. So the muscle spinal cord covering, and there's a connective tissue bridge that connects the two. So that was the new anatomical finding they found in the mid-90s, and this had implications as far as tension headache is concerned. And basically what they found is when someone sustains a neck injury and the upper neck becomes locked out of position, the muscle tone at the base of the skull becomes hypertonic. The muscles become tight. And when the muscle becomes tight, that puts tensile stress on that myo-dural bridge and actually pulls on the sheath that covers the spinal cord. And so upper neck injuries are now known to cause cervicogenic headache. Basically, that means a headache that's caused by your neck from a neck injury. So basically, the work that we do in our office in Los Angeles and upper cervical doctors do throughout the country and actually world, we're specialists in determining exactly how that top vertebra is shifted off the floor of the skull. Everybody's different. One person may move up and forward to the left, another one to the right, another one back into the right. You can have 10 people that move back into the right, and they may have all different configurations in their joint anatomy. So upper cervical chiropractors are trained to determine exactly how your vertebra is misaligned, and then to precisely and gently, no cracking, no popping, no twisting, to realign the segment, get it from its locked position back under the body's control. And what happens when the vertebra is corrected, the muscles at the base of the skull that have been tight start to release, people's mental clarity comes back, headaches start to clear, posturally, because the muscle tone through the spine is all controlled in the neck. When the upper neck is corrected, postural imbalances start to correct. So not only is upper cervical chiropractic good for people that are suffering headaches, but it's good for anyone, whether they're sick or healthy, so they can be at their best. Because at the end of the day, the upper cervical chiropractor's goal is to correct nerve irritation and interference at the base of the skull so the body can function better. So if you have anyone, family, friends, or acquaintances that are suffering from tension headaches, or for that matter, any other chronic health condition, it's very important that they get to an upper cervical chiropractor to find out, do they have an atlas that's locked out of the position that's interfering with their body and causing them not to be as good